Good morning, everybody. Welcome to another edition of United Way for Southeastern Michigan's What's the Word Wednesday, where we share important resources and have vibrant discussions about the topics that matter to you. My name is Bridget Herman, and today we're joined by the leaders of two prominent United Ways to discuss about the merging of these two impactful organizations that have been long-standing and necessary in the communities they serve. A few reminders about today's discussion. We do hope to have time for a few questions from the audience, so please put your questions in the chat box on Zoom or into the comment section if you're joining us on Facebook. Closed captions are enabled in Zoom and Facebook Live, and so to turn those on, please click on the Show Captions button at the bottom of your screen. United Way for Southeastern Michigan and United Way of Washtenaw County are both mission-driven service organizations that have a shared vision for our region and a proven ability to drive meaningful impact. As of June 28th, 2023, both United Ways will be merging for a brighter future. I'd like to introduce you to our panelists for today, Dr. Darienne Hudson, the CEO and President of United Way for Southeastern Michigan, and Pam Smith, the CEO and President of United Way of Washtenaw County. Welcome, Darienne and Pam. Thank you both so much for being here with us today. Before we go into our discussion, I'd love to hear more about you and the amazing work you do. Dr. Hudson, would you like to get us started?
Certainly. Good morning, everyone. Thank you for joining us. I have the privilege of leading this amazing organization and have been doing so for the past 5 years. Our United Way is focused on ensuring that every family within our reach has children who are thriving, that they feel that they are stable, and they live in communities that are equitable. We do this in partnership with literally thousands of partners and people across our region and across our state to make sure that all of our families are able to meet their most basic needs. And this merger is really an exciting moment for us in our history. And I couldn't think of a better partner than Pam Smith and the United Way for Washtenaw County. Her vision and her tireless efforts and her selflessness have really been the heart of this merger and this partnership. And I'm really excited to be here with her today and to share this exciting moment with all of you.
That's a great segue, Dr. Hudson. Pam, I'll turn it over to you.
Thank you so much. And hello, everyone. Thank you so much for making time to join us. Thank you, Dr. Hudson, for those kind words. My name is Pam Smith. I'm the current CEO of the United Way of Washtenaw County. I've led this organization for about 12 years. But really what we have to think about is our 100-year history. Now, I'm not 100 years old and haven't been here that long, but I know that I take great pride in continuing the work that was started over 100 years ago in our community. And more importantly, I think the leadership is really a nod to our volunteers and our donors, people that have invested so much time and their talent to make sure that our community is thriving. We have a vision here that by 2030, your zip code will no longer determine your opportunities in life. And I know that by partnering with Dr. Hudson and the wonderful team at the United Way for Southeastern Michigan, we'll be able to make that come true. We're going to work hard. We need our volunteers and donors to stick with us, our partner agencies, the nonprofits that do incredible work in our community to make this really happen. So thanks for being here today. We're excited to share all about the merger.
Thank you both. Thanks, Dr. Hudson, and thank you, Pam. Appreciate you sharing a little bit more about yourselves and your vision for the organizations and the work that you're doing. We do have a few questions for both for you that we've prepared, and we'll be taking questions from our audience. So audience members, as we're having this conversation and as you're hearing from Pam and Dr. Hudson, please feel free to once again add your questions into the chat on Zoom or Facebook Live. So to get us started, Pam, I'm going to turn to you for our first question. You know, folks are coming here from lots of different places and may not be familiar with the United Way network. So what's important for those joining us today to know about United Way?
United Way is based in community. It focuses on the needs of families, children, seniors, adults. We make sure that there's a safety net of support available so that every person has access to what they need in an equitable and fair manner.
Thank you for that. That's a grounded introduction. Dr. Hudson, would you like to build on that in any way before I turn to our next question?
Certainly. I just want everyone to understand that our United Way, we are actually fueled and powered by people. And so for anyone who is wondering how they can get involved, where do they start? We have 50 United Ways across our state. Pam and I represent 2 of them. So if you're looking for help or assistance, you can call 211. Many people are familiar with that. That is connected to all of our United Ways. And just in our region alone, we're connected to 1,300 different organizations. So you start with us and you are literally connected to the world. So we hope that anyone who is curious, you can go to our website, but you can also just know that starting with us, you will be plugged in literally to all of the nonprofits in our region and around the state.
Thank you for that. You know, the reason we're all gathered here today is to learn more about the merger between these 2 United Ways. And I think folks are pretty curious around the context and the circumstances that brought this to being. And so Dr. Hudson, I'm wondering that if you could share first with the audience members, what were some of the key reasons behind the decision to merge United Way of Washtenaw County with United Way for Southeastern Michigan?
Certainly. So we all recognize that during COVID and in the state that we even find ourselves now, that we have to do things differently if we're going to be able to get the resources to the people and the organizations that need them most. We were forced to really look at our business models. I believe this is something that all United Ways are grappling with and trying to assess how much funds we are able to raise and acquire versus the needs that we see in our community. So Pam actually initiated this conversation and this merger conversation 18 months ago. It started as a shared services conversation, looking at how we're able to offer human resources, talent development resources, as well as people and culture initiatives that we're able to share with Washtenaw County. That's actually been in place for the past year. That evolved into what is now this conversation around merger. And I really want the audience to hear about the hard work that Pam and her board of directors did in their strategic planning to get to this point. But for us, it only makes sense. We are all Southeastern Michigan. I am a U of M alum. 2 of my cabinet members, my CFO and my HR VP are from EMU or went to EMU. We have a number of staff who live in Washtenaw County, and we have board members, 2 of our officers actually, who live in Washtenaw County. So we just feel that this is really our home, and it made sense. And the timing for this really was critical given where we are now in our community.
Great. Pam, it sounds like there's a story waiting to be told around the circumstances and board governance practices. So we're all ears around that story that brought us to this point.
Absolutely. So I'm fortunate to work with leaders and board members that are willing to have courageous conversations. And we knew during the pandemic that we were going to have to come out of the pandemic on the other side, a different organization. There had been changes in giving, there had been technology changes, and we knew that we wanted to be different, that the need that had been exacerbated by the pandemic needed to be addressed, and we needed to be in a position where we were going to be able to do that. So we started a Preferred Futures subcommittee within our organization, made up of board members and local volunteers, and really went through multiple scenarios to see what would serve our community best. When we sent our community, what were we hearing, what were the needs, and how were we going to move forward? And to Dr. Hudson's previous point, the United Way for Southeastern Michigan and United Way of Washtenaw County have a rich history of working together. We've built bridges over the years. We've made sure that things that were happening in Washtenaw County, we knew were similarly happening in the 3 counties that they already served. So we wanted to make sure that not only did we continue the legacy of working together, but how could we be better? How could we make sure that we were maximizing our resources, maximizing our leadership and expertise to really get to the heart of the matter of what does the community need to flourish? And so over the course of the last year, we worked through multiple scenarios, and we did a full SWOT analysis and financial review of all of those scenarios, staying the same, continuing our shared services model, possibly merging with another local nonprofit, or what made the most sense was merging with Southeast Michigan because of that history and that legacy of working together. So we know that by doing so, we're going to enhance our ability to serve, and we're excited for the future.
Connected to that, Pam, I'm wondering if you could talk a little bit about what changes folks can expect to see after the merger. If you're a donor, if you're a volunteer, if you're a grantee organization or a community partner. So could you talk a little bit more about that? And then I'll turn that question to Dr. Hudson.
Absolutely. So we know that we are rooted in community, and it was important when we began this merger conversation that we said we'd love for our local office to remain open. And United Way for Southeastern Michigan immediately was like, of course. We wanted our team to remain in place, the people that know our community oh so well and have worked for so long to build those networks. And they said, of course. And so I'm really proud that we centered people, place, and impact throughout this merger so that our team will remain local, our office will remain local. The grants that we've already made and are committed to will be honored throughout the grant cycles by United Way for Southeastern Michigan. And then they came back and they said, you know, we've already invested close to $250,000 in your community already, which I always appreciated throughout COVID when I went to Dr. Hudson and talked about the need in our community. They just continually responded. So while things will look a little different moving forward, just because the United Way for Southeastern Michigan has so many great programs and initiatives that simply because of our size, we weren't able to have in Washtenaw County. So those things, those programs, new grant opportunities will come to Washtenaw County because of it. Dr. Hudson?
Sure. I just wanted to build on that. I'm not sure if everyone is aware, but when Pam talks about our rich history, we actually, for the past 15 years, even more than that now, we've been providing 2-on-1 services to Washtenaw County. Those will continue. I think what people will also see is more hands on deck, more hearts invested in Washtenaw County. We have a staff of approximately 200 that will eagerly be welcoming the community of Washtenaw, and also just pouring in more support and more resources. As you noticed, Pam was giddy when she was talking about all of the different conversations that we had. And I mean, the answer really was so simply for us, yes. And the sentiment is the same for our staff as well. They are already vying for office space in Washtenaw County and asking when can they start coming into the county because there is so much passion for this work, understanding the needs that we see in Washtenaw County, and everyone is ready to get started.
Thank you for that. This question comes from a community member, Maria. Maria would like to know a little bit more about the services that will be coming to communities as part of this merger. And so that could be across the 4-county footprint and or specifically to Washtenaw County. I've heard you talk about 2-1-1. Are there other services that folks can expect to see or be eligible for as a result of this merger, Dr. Hudson?
Yes, so we currently have a number of different programs. It's our client service model. It's everything from utility assistance, assisting with water shutoffs. We've already partnered with our food pantries. Pam and I worked with DTE earlier this spring once the SNAP benefits had ended on March 1st to get resources out through gift cards to Kroger, as well as resources to the food pantries. That included Washtenaw County residents and organizations. We are very passionate about people being able to feel like they could just walk in and receive services. And that's something that Washtenaw County has already been doing in terms of being open to the community. And so we have a special committee that is focused on investments specifically for Washtenaw. So whether it's through grants, through us looking at our different offerings of client services, I can't tell you how many opportunities are already starting to come through. And I can't say exactly what they are because we're in the application process, but we are now more eligible for grants, whether it's at the county level. We actually have a meeting today with another group of partners in Washtenaw County that are ready to apply for more grants and resources. This really opens the gates for our eligibility for these different grants, as well as having more people to serve. So just know that the different areas, whether it's tax services, whether it's digital inclusion efforts, our education and our community schools programming, there really is no shortage of offerings and opportunities. So stay tuned. Literally every week we are getting new opportunities to be able to service the community. So this won't be the last town hall. So Maria, if you're listening today, please tune in. The next few months, we have quite a few announcements that we're anticipating and bringing to Washtenaw County.
This is all really good news. Thank you for sharing that. This is really, really exciting for folks. I'm wondering, Pam, if you can talk a little bit more about maybe how this merger is going to benefit the county residents Washtenaw County United Way currently serves, and those who might be served in the future. And I'm particularly thinking about Alice. As you all may know, there was recently released data on Alice households. Those are folks who are asset limited, income constrained, and employed. These are households who live above the federal poverty level, but below area median income. And through the period of 2019 through 2021, those numbers went up dramatically in all 4 counties, especially Washtenaw County. And so those are folks who are one car breakdown away from being in crisis. These are folks, your home health aides, teachers' aides, nonprofit workers, food service workers. And so really with an eye towards Alice folks, how do we think this merger is going to impact them? Pam, I'll turn to you first to chime in.
Thanks so much. And I believe that we're going to drop the Alice link in the chat so that our listeners and the people that have joined us today can, if they want more information, can look there for more Alice info. But what's so important about the Alice report is it really sheds a light on the entirety of the community and what the needs actually are. So in Washtenaw County, sometimes we'll hear, oh, I don't see poverty. I don't think, people are in need. But when we go back to 211 and we look at 8,000 calls for help, just in Washtenaw County alone, and Dr. Hudson, when I pass it off to you, I'm sure you can share how many calls come in through the whole network. But the things that are most important to people when they're calling 211 is things like utility assistance, eviction prevention, food security. And we see it every day in Washtenaw County. The headlines in MLive yesterday were talking about how rents are increasing so dramatically. And those very people, Bridget, that you mentioned that are working 2 jobs, sometimes 3 jobs, just to keep, food on their table or a roof over their family's head. Those are the people that we're really thinking about, because 211 or food pantries or utility assistance is all available through United Way. And what we're seeing is more people are accessing those emergency services because they're stretched so thin on their family budget. So when we're talking about working together, and Southeast Michigan is bringing so many new or different programs and opportunities for assistance to our community, it's just one more fact that the reason this merger was so critical at this time and so important.
Thank you for that. Dr. Hudson, I'll turn to you.
Sure. So through 211, we actually get anywhere between 200 and 250,000 calls annually. This is, again, whether there's a flood, there's natural disasters, or people are just experiencing day-to-day needs. This is what this call service is for. Our communities and our families in Washtenaw County are a top priority for us. And as you've heard with our Alice report, we saw the percentage of our families who identify as Alice go from 30% to 40% in 2 years. We know that the cost of living is really, and the rate of inflation is suffocating our families. And these are hardworking families that are trying to provide for themselves and for their children. So there isn't anything that is more of a priority. What I ask for those who are listening is think about how you can be part of the solution. We have a program now called the Financial Wellbeing Innovation Challenge, and we are getting ideas, grants, programs from our community members who are applying for the resources to be able to start solving some of these tough problems. So we don't intend to just come and just do. We really want to do this in partnership with all of our community members. So please don't hold back as you have suggestions or ideas on how we can better serve and how we can make sure that every person in all of our counties really feels their united local way and the resources that we're able to offer.
Thank you for that. So really a net positive to be able to expand and work at scale, attending to Alice families who are at the heart of the work that United Ways do. You know, something that also is a focal point and a value that both United Ways hold dear is a commitment to finding a full expression of diversity, equity, inclusion in all lines of business, from your community-facing work to your internal operations to your hiring practices. And so knowing that equity is important to you, Dr. Hudson, I'm wondering if you can share a little bit more about how aspects of diversity, equity, and inclusion will be incorporated following the merger in the work that comes.
Certainly. So equity and inclusion are core values, in addition to being a people-first organization, as well as being focused on collaboration and innovation. We have been an organization over time that has really used our data to help us understand where inequities exist and how to tackle them. We've talked, at length about the Alice report, but what we haven't talked about yet is that it actually provides demographic data. So allowing us to see that over 60% of Black Michiganders and Latinx Michiganders are actually identified as Alice, that 66% of our seniors are identified as Alice, and even 66% of our youngest population under 25 is actually falling into that category as well. Having this information across all of our 4 counties, being able to look city by city and understanding that Alice families exist everywhere. And so how are we going to actually deploy resources has been something very strategic and very intentional. We have a handful of cities in our region that have suffered in terms of infrastructure over time. Their school systems, some of them no longer exist. So we have to have a really intense focus on how we provide resources and support and partnership to different nonprofits and community leaders in these areas. We do have a handful of flagship programs that our community will benefit from, particularly across the 4 counties. Wanted to share, we do have our racial equity fund. We've now been able to invest over $2 million into the community, focusing on organizations that are BIPOC led, focusing on organizations that are in some of our hardest to reach pockets of our community with very vulnerable populations that need support. We're very proud of the fact that we have a strong supplier diversity program in place. This is actually part of our governance now. In assessing, are we investing properly and providing opportunities for vendors and organizations that are women-led, that are minority-led. We are thrilled the opportunity to be able to expand our partnership with the 21-Day Equity Challenge. And I don't want to steal the thunder from Pam, but everyone needs to know it started in Washtenaw County. We are so proud of that. We tell anyone who will listen in terms of how we're able to expand our 21-Day Equity Challenge. We have 10,000 people join us this year. And so now in partnership, yes, we keep growing, Pam. So now in partnership with Washtenaw County, it's part of our home. It's only going to continue to grow. So this is not just a conversation. These are deliberate actions. We have demographic surveys. We have engagement surveys with our staff that we take very seriously, that we're doing annually to make sure that everyone feels included, that people, if I could say this, they feel loved and they feel valued, not only when they're coming to work, but when they're volunteering with us and they're receiving services from us.
Thank you, Dr. Hudson. Pam, what feels important to add when thinking about how diversity, equity, inclusion will be incorporated into work following the merger, or legacies that you hope will carry forward?
Yeah, I think what Dr. Hudson just shared shows how integrated and how DEI work permeates all that we do. I was always so proud when Bridget, you started making sure that our volunteers that review our grant applications and make those grant decisions went through implicit bias training so that they'd have a deeper and broader understanding of equity when they were reviewing our grant applications. And then, as Dr. Hudson so kindly, mentioned, we began a 21-day equity challenge here in Washtenaw County way back where we started planning in 2019. And with their help and the help of other United Ways around the country, equity challenges are now being held in more than 27 states. 300,000 people have engaged in a conversation about equity in their communities. So I think it's really important to understand that this network is so strong. And this network, when we I know this sounds like, when we live united and we really work together, great things can happen for all of our communities.
Thanks, Pam. We both United Ways stored very important relationships with donors who believe in our mission and support us and make all of this work possible in combination with our volunteers and staff. And so I'm curious if you can share a little bit about how will the funds raised be invested efficiently and equitably in partner programs and communities across this 4-county footprint of Wayne, Oakland, Macomb, and now Washtenaw. And then I'll turn that question to Dr. Hudson.
Absolutely. So when we talked about the merger and we centered people, place, and impact, we talked about how important it was for local dollars, not only to be invested locally, but to continue the legacy of local volunteers making those decisions. And so working with Dr. Hudson and her team, there will be a Washtenaw Impact Committee, still local, made up by local volunteers, determining those local investments. So it's really important while we work as a team and we cover a broad region, we'll still have the ability to kind of go deep in community. And that's based on our volunteers. We have such a dedicated group of people that have kept this organization. They're really the engine of this organization for the past 100 years. United Way exists because the community needs us. They demand it, and then they show up to make sure that it's really happening. And so I'm really happy to say that things will still remain local, but we'll also be able to maximize the power of working together. Dr. Hudson?
Yes, so we actually have a framework that we've incorporated since 2019 as well. It's called the Centering Community Voice Framework. It was created by Detroit Future City. So this really radically changed the way that we go about our grant making and making sure not only that we have our volunteers who are coming together, but we actually have advisory groups that are helping us assess where our funds are going, making sure that we are making equitable decisions in terms of how the resources are allocated, who's even able to benefit from these resources. We're a large organization, and that can be daunting to our community members who are trying to apply. So we actually provide quite a bit of what we call technical assistance, but essentially that just means we're sitting elbow to elbow with our partners, walking them through the application, helping to answer questions directly. And we intend to continue to do that. So whether you're applying for our equity and education dollars or wraparound services, whether you're applying for a basic needs grant, just expect that you will have an opportunity to participate in webinars that you can call at any time to be able to actually have that walkthrough and explain not only how to apply, how to get those resources, but so you can apply this to other organizations that you're seeking resources from. Having this investment committee that's specifically focused on Washtenaw County will allow us to really do this on the ground in Washtenaw County. So in addition to having our larger community impact council that's helping to make these decisions at the board level, we also have the structure that will focus specifically on Washtenaw County. We're very much committed to making sure that we keep community voice centered at the table as we are making these investment decisions.
And just one more follow-up. It's important to remember that the team now of people that can connect with our donors is so much bigger because of Southeast Michigan. And so while our resource development people remain on the team, they now have so much more help. So donors can always reach out, they can always connect, and we will get back with any answers, to their questions that they have in a very prompt, and responsive manner, because we understand how much the donors contribute to our overall success. So we appreciate that.
Thank you for that. Change is exciting, and change is also really challenging to kind of navigate in the moment and to receive that change is happening. And so I'm thinking of, this announcement. Well, yes, this is a net positive for Washtenaw County. It'll also be, news and something new that we all have to wrestle with as community members. And so, I'm going to turn the floor open to you, Pam, first, and then Dr. Hudson, if you could share a little bit more about what feels important to share in general with audience members about the merger. The floor is yours. What feels important to share that you want to make sure folks understand about this work? We've covered some more formulaic questions, but this is just open-ended for you and Dr. Hudson to chime in and share what feels most relevant.
I think the agenda for change is a bold step forward, and we want our donors, we want our volunteers, we want our nonprofit agencies to step forward with us. And they can do that through volunteer opportunities like volunteerwashtenaw.org, also volunteering at Southeast Michigan. And I think change can be scary for people, but it also can be so empowering. We have to be proactive in addressing the intersectionality of poverty, racism, and trauma in our communities. And we can only do that when we work together. And I feel so blessed and fortunate to do that with Dr. Hudson and the team at United Way for Southeast Michigan.
You're here. Dr. Hudson, what feels important to share with audience members about the merger in this moment in time?
Sure. I would just say that change takes courage. But courage is something that we all have within us, and it takes courage. It took courage for Pam as a leader to just step forward and say, I know that we need to merge to be able to better serve the community of Washtenaw County. It takes courage for all of the staff members to raise their hands and say, we are going to stay, we're invested, we're going to continue to work with this newly merged organization. It takes courage to be a donor, to trust that your investments are going to go to the communities that you care about most. And that's something we are very committed to as a United Way network. So I want to make sure I'm stressing that any investments from community members, and you have the ability to be able to designate and direct where you want those funds to go, that will continue. But we're very excited. This is a moment in time in our country and in our history that demands courage. And that really is the fabric of the United Way network. And so being able to do this in partnership with the community in Washtenaw really is a privilege. It's an honor, but it is necessary if we're really serious about getting our arms around what we know our communities need. This isn't happening by accident that this ALICE report just came out. And we're seeing such a drastic increase in families that are struggling to meet their needs in Washtenaw County. It's going to take all of us, all of our resources, our expertise, our talent, our treasure to be able to support the families in need. So, I just ask everyone who's listening today to please just lean in and take this bold step with us because it is what our community needs most. And we all have the strength, the ability, and the courage that's necessary to be able to take this on and be able to make the change that we want to see.
Thank you, Dr. Hudson. I want to check in with the folks behind the scenes to see if there are any questions that have come in from Facebook Live or from audience members on our Zoom call. So I will, I'll pause and see if any questions have come in. Okay. That means we've done a really good job, Dr. Hudson and Pam, covering all of our bases. Okay, fabulous. Well, I want to move us along then with our time together and make best and highest use of our time today and time of our audience members. I want to thank both of you for joining us today, Pam and Dr. Hudson, leading our communities, answering our questions about the merger. Before we close, I do have some updates for our audience that I would be remiss if I did not cover. As Dr. Hudson mentioned, 211 is available for anybody in our community who might be experiencing a need. Our 211 helpline remains available 24 hours a day, 7 days a week, 365 days a year. You can call at any time to get information about resources like food, utility assistance, child care, elder care, and much more. About volunteering, if you're looking for opportunities to get involved in our community, as a volunteer, we've got you covered, and our volunteer portal can help. Our online portal helps you search for volunteer opportunities that best match your abilities, your needs, and interests. It even lets you set up event alerts for the types of volunteer projects or organizations that you care most about. So visit unitedwaysem.org/volunteer to get started. And stay tuned for our next town hall. Our next What's the Word Wednesday town hall will return soon. So keep an eye on social media and emails from United Way for Southeastern Michigan about our next town hall. And to stay updated on upcoming topics and to watch replays of previous town halls, you can visit our website at unitedwaysem.org/virtual town halls. Thank you everyone for taking time out of your week, out of your Wednesday morning to join us today. Thank you to our wonderful production team for making this happen and making it easy to participate and get this conversation out to community members. We'll see you soon. Take care and make sure to live united. Have a great afternoon.